Hi, everyone. Thanks for joining this virtual town hall today. It's being put on by the DiabetesWise team. My name is Corey Hood, and I'm a psychologist and professor at Stanford University and part of the team that created DiabetesWise. We're really excited that you're here and you're attending today. We've got a great program today. I'll tell you a little bit about DiabetesWise. If you don't know this, we created this to be a free, unbranded resource for people when they're thinking about getting on diabetes devices. We did this with the support of the Helmsley Charitable Trust, and they're also supporting this virtual town hall. So the goal of this series now is to support people in this very stressful time in the world. So for today's session, we're excited to talk a little bit about continuous glucose monitoring, and I'm going to turn it over to our moderator in just a minute. If you have questions as we go through, drop those in the chat feature, which is at the bottom of your screen. And you can feel free to put those to just the panelists or to the entire group. Sometimes putting them to the entire group allows other people to comment on it as well. Just also pay attention to the chat, because there'll be a couple of links that we send around for you to complete in terms of what you thought of the session, but also if there are other topics that you think would be good to hear. So I'm going to turn it over to our moderator, Kyle Rose. We're excited that Kyle has been helping us and been part of the DiabetesWise.org team for at least the last 9 months or so. But Kyle, first and foremost, is an advocate interested in obviously advocating for people with diabetes. Some of his prior roles have included positions with My Sugar. He was employee number 1 there. I think that also means he may have been the best one, but he's worked with Abbott and Medtronic and other groups. He's also really active in the nonprofit world. He's on the board of directors of the International Diabetes Federation and has been on Team Type 1. And some of the things that Kyle's worked on in the past, he's been part of larger ventures that have moved and are becoming active resources for people with diabetes. He was part of the major acquisition by Roche of My Sugar, and so he really takes a lot of pride in seeing these products to the user so that they can be used in a great way. And so we're really excited to have Kyle with us today. So I'll turn it over to Kyle now.
Thanks very much, Corey, for the warm introduction. Absolutely not. I didn't intend to mean that I was the best number 1 in that sense for My Sugar. My actually whole goal is surrounding myself by people who are a lot stronger than me, as was the case at My Sugar, and again at DiabetesWise, with people doing amazing work. So it's been delightful to join the team. Without further ado, I'd like to introduce our panelists today. And we have Carrie Leone joining us from Dexcom. Carrie is the Senior Director of Global Medical Science and Education. She's been at Dexcom for a number of years. And she previously was working in the diabetes industry for other companies, but is intimately familiar with medical device in diabetes and very committed to the cause. So I've known Carrie for a number of years. I won't date ourselves, Carrie, by saying how many, but thank you for your commitment to diabetes. Thank you for being here today to represent Dexcom, one of the leading companies in the space, particularly for CGM. We also have with us Naya Grant, and thanks to the wonders of the diabetes online community, the gift that keeps on giving, I had a chance to be introduced to Naya, who has, I think, a really compelling story that we'd like to go into today with some examples of things that she's gone through with her own diabetes that I think will resonate with many of you today. So Naya, in addition to being here today and her patient advocacy work as part of the CWD, Children with Diabetes faculty and staff, who just had their major conference last week virtually with over 5,000 people, I heard. Congratulations to you all on that. As well as being an advocate for the LGBTQ+ community. So we're looking forward to getting into your story. I wanted to just briefly start today with the following comment. And in these unusual times, I'd like to acknowledge that there are sections of the diabetes population who might not have easy access to the technologies or devices we're talking about today, whether that's because of financial reasons or the systemic problems that we also know exist in the medical community in the form of healthcare inequity, particularly faced by those of the Black and brown communities. Today, we'll be discussing some of the programs that have been developed to help people living with diabetes, but we know there's still a lot of work to be done. And I believe I speak on behalf of the whole team in saying that we strive to help empower and educate, but also expand access to those in need. Without further ado, Naya, I'd like to throw it over to you with the following question. Could you tell us a little bit about your own diabetes story? When were you diagnosed, and what's been the biggest challenge so far with diabetes?
Sure, Kyle. Thank you so much for that great introduction. My diabetes journey started when I was a senior at Spelman College in Atlanta, Georgia. It was right before the midterm break, and I started to feel sick, but like every student, I figured that it was due to the fact that midterms were coming up. I was graduating, so I was running every which way, and that's why I kept running to the bathroom every 20 minutes and whatnot. So my sister, who was a freshman the same year that I was a senior, she and I and some friends had planned a trip to Florida to visit some family members and just sort of de-stress in the parks. And we get there, and the longer we stay, the worse I got. So we got there on a Sunday, and by Friday, I had stopped eating and was just generally not doing particularly well. So I called my mom, and I was like, Mom, it's 6 o'clock in the morning. I don't know what to do. I don't feel well. And she said, well, wait another hour. Your aunt should be up. Ask her. She's a nurse. She'll be fine. And so I did. And my aunt takes one look at me and is like, I really think you should go to the hospital. So she wakes up my sister and our friends, and we all pile into my car, and my sister drives, and we get to the hospital, and they're having us fill out, standard intake paperwork. And they hand me the paperwork, and I can't read what's written on there. So I hand it to my sister to fill out, and, we give it back to the desk, and we were sitting there, and in reality, what was probably about 10 minutes, but when you're not well, it always feels like 2 hours. We're sitting there, and I remember saying to my sister at one point in time, why is this taking so long? Don't they know we have good insurance? Now, mind you, this was 2007, so I don't know why that thought went across my mind, but it is one of the things that I remember distinctly about sitting in the hospital and saying, we have good insurance. But anyway, the doctor called my name, and they pulled me back, and they did all the tests, and this very nice doctor came up to me and said, how long have you been diabetic? And I was like, no, I'm not diabetic. I was at Disney a couple days ago. I had some soup. It was 90 degrees. It was cream-based. We all know that this was probably not the best idea. And he's like, no, you have type 1 diabetes. We're going to keep you here for a little while. And at that moment, the next thought was, well, you're going to have to tell my mom, because she's never going to believe me when I tell her that this is what's going on. And so I said, do you mind telling my mom? And he goes, yeah, sure, I can tell your mom. Where is she? And I said, no, she's on the phone. So I called my mom, and I can hear the doctor's half of this conversation. Hi, Mrs. Grant, my name is Dr. So-and-so. I'm, treating your doctor at this lovely hospital. She has type 1 diabetes. No, ma'am, this is not a false positive. We're not entirely sure where diabetes comes from or what caused it to trigger in your daughter. But we are going to take good care of her. She's going to need to stay here for a couple of days. She's going to need to be on insulin for a while, and we'll take it from there. My mom showed up the next day, because that's what parents do. And we've been taking it one day at a time ever since. And I think the second part of your question, I've now forgotten, since I've rambled on about myself for the last couple of minutes. So if you wouldn't mind repeating it, Kyle, I'll be happy to answer.
Of course, yeah. And thank you for sharing that. The second part of my question was, what's been the biggest challenge of diabetes management, or your diabetes in general so far? Hard question.
I think, so I was diagnosed at age 21. So I think the biggest thing for me is maintaining that consistency in life. I am very much a get up and go kind of girl. There does not need to be a purse or shoes that match or any of those things. I need my keys, my wallet, my cell phone, and I am out the door. Diabetes requires slightly more planning ahead. So for me, the biggest challenge is figuring out how to maintain that simplicity of, all right, it's time to go, keys, wallet, phone. and out the door. Now it's keys, wallet, phone, Dexcom, and out the door. But it's trying to just sort of maintain that balance, and being able to do the things that I like without having to worry too much about what diabetes is going to do that day.
Yeah, fair enough. I think that resonates with many living with diabetes. It's sometimes feels like you're looking at a formula about questions. And if you're missing one of the pieces of equipment that helps you fill in that formula, things can get very complicated quickly. Living on the go is hard, but it sounds like you've, based on what you've told us and what you've told me so far, done a pretty darn good job of it. So looking forward to hearing more about that. I'd like to kick off our poll questions now, so we learn a little bit more about our audience. As I do, I'll take the opportunity to introduce the folks that are doing that for us. Monica Lanning, maybe if you can raise your hand, Monica, yeah, and Sierra Nelms, if you could raise your hand, Sierra, have been here at the DiabetesWise Project long before me. So not only do I get to work with the great Corey Hood, I have an amazing team that I've been working with. Thank you for your support. And I just wanted to acknowledge you to the greater audience. Can we kick off the first poll question, please? I see some responses coming in already. You guys are quick. All right, well, looks like we, so I think if we end that, that'll post then the results. There we go. So we have a bit of a mix. Looks like about a third of folks are living with type 1. We have some type 2 folks as well, some people caring for people living with diabetes, healthcare professionals, and otherwise. So thank you for answering the poll question. I'm going to go back to Naya now with another question. Naya, what has been your experience with the diabetes medical devices and with diabetes medical devices in general? The good, the bad, and the ugly. We want to hear how your experiences have been, and the second part of that question once you respond to that, please.
Okay. So the good, the bad, the ugly in terms of glucose monitoring. I will start with the ugly, and I will say that the first CGM that I used was by Medtronic, and I'm sure we're all familiar with it if I say let's go on a fishing trip. And so that was my very first experience, and I think I used that a couple of times, and it was, at the time, it served the needs that I had. That needle is forever ingrained in my memory, and I think anybody who's ever used that particular sensor knows what I'm talking about. But at the same time, we should remember, this was first generation of this technology, and so it was a little rough around the edges. It did have some room to travel, and we were at the time blessed to be able to have that technology, as ugly and sometimes scary as it could be. The bad for me was right in 2012, so a couple years right after I was diagnosed. I had attended a conference with Nicole Johnson, who was running the Students with Diabetes conferences in Florida. And I had encountered some folks who were on CGMs, and they were telling me about all of the wonderful experience that they were having. And I said, well, I want one too. So I went to my doctor's office and I said, I've been talking to some friends. I'd like to talk about getting on a Dexcom. And his answer to me was, well, your A1C is 6.5. So I don't think you need one. Now, if a doctor had said that to me today, I think I would push back and say, well, yeah, but I could have a better A1C and a better quality of life if I'm not constantly checking my blood sugar, or if I'm not having to treat lows in the middle of the night or in the middle of the day. If I knew what was happening at any given time, I could certainly manage my diabetes better. But that was then. This is now. Different people, different conversations. And the good has been my experience in relationship with Dexcom. I've had some insurance issues at different stages in life, but I've also, for the past at least 5 years, had a consistent relationship and consistent ability to be able to use a Dexcom product, and it has revolutionized my life. I jokingly say I am happily a walking billboard for Dexcom and Tandem. That partnership has served me exceptionally well. I know it's served others as well. So there's the good, the bad, and the ugly.
Thank you. Yeah, and I think the description that you're sharing resonates with all of us just in general when we think about devices and something attached to our body. It can be frightening and a process to go through. It's interesting to hear how that's developed over the years for you. The second part of the question was, do you currently have, or have you ever had any reservations? And I think you kind of responded to that in the way you described one of the devices. But do you currently have any reservations about, not necessarily the CGM category, but devices in general?
I personally do not have reservations about CGM technology or pump technology or new diabetes technology in general. Again, I'm fortunate to have a job with good enough insurance that if I went to my doctor and say, I want to start on the Libre, he would probably give me a little bit of a side eye, but at the same time, we'd have the conversation. But my sort of guiding principle is I fell in love with Star Trek when I was probably about 9 years old. And so technology and, bold new world and what comes next is always something that I have been in love with and want to experience as much as possible. So my reservation is I don't have them because I want to see what comes next. Like what's the next step? Where's the journey going to take us next? And I understand some people do have those reservations. And my answer to them would be, talk to other people. The internet is a great thing. You can reach out and talk to other folks. You can meet people who've used it. You can meet people who've loved it, and you can meet people who've hated it. And then you can make that informed decision as to what step in your journey is going to be best for you.
I think that sets us up well for the next poll question, if we could please, to hear from our audience as far as which devices are most interesting to them. All right, I see some responses coming in already. I think we can close that one up. So looks like, yeah, we have from what we'd expect in terms of on the monitoring side, BGM, a fair amount of CGM already, pens and syringes, pumps, pretty evenly split there. Some folks on automated insulin delivery devices already. If we could actually go right into the next poll question, because I think they're kind of tied, the two of these, in terms of what do you currently use and maybe what would you like to use? Okay, we'll give it a few more seconds. So it looks like people are really interested to hear more about CGM and automated insulin delivery to AID stuff. So that's good because we've got our CGM session today and our insulin delivery system next week around this time. So we'll hope you join in that one too. On that note, I'd like to just kind of have a chat about what you mentioned, Naya, because I think that is probably something that happens more often than we might know. And that is your experience with the healthcare professional. You essentially described a healthcare professional that, for perhaps a number of different reasons, wasn't feeling comfortable writing the prescription. And I think that's a great segue over to Carrie. Carrie, how often are you hearing about this as a company in your role? Is this taking place frequently? and any reactions to what Naya has shared with us.
Yeah, so first off, I definitely empathize with what Naya was sharing. And I would say that the biggest challenge that I think we feel as a category of CGM, but specifically Dexcom, is the awareness of coverage. A lot of times we hear from healthcare professionals and patients that CGM isn't covered. And so I think the definition of coverage is what I always like to educate my patients with diabetes and people with diabetes, and just level set a little bit, is if you look at all different types of insurance plans, you've got your commercial payers like Cigna, Aetna, Blue Cross Blue Shield, and you've got your federal or government coverage of like Medicare or Medicaid. And I want to just kind of big picture, love to give everyone hope and the truth about where are we with access and coverage for the category of CGM. This isn't just Dexcom. So overall, for our commercial coverage, we have for all non-federal channels, CGM is covered for type 1 patients. And what's really interesting is we are growing as a category that is also covering for those who have type 2 diabetes on intensively insulin managed regimens. So we're seeing more and more, not only for our type 1s, but our type 2s that are using 4 or more injections per day. And that's for our commercial coverage. Now, if we look at Medicare, I don't know how much people we have on the call that is 65 and older. It's a huge win, actually, that people don't realize, is Medicare covers for CGM for anyone with type 1 or type 2 diabetes on intensive insulin managed regimens. So if you're on a pump or MDI, if you have type 1 or type 2, it's covered. And then if you jump into Medicaid, you've got all 50 states. A little bit more of an uphill mountain to climb there, but we have 37 states that have CGM coverage for Medicaid patients. And of those 37 states, we have 14 of those states that will cover through a pharmacy benefit. And why is that important? Why do I mention that? Oftentimes when I speak to patients and they say CGM isn't covered, it's because their policy, say with Blue Cross Blue Shield of California, has a very high deductible, and they may have to spend $5,000 before it is covered. But the criteria is met, but the dollar isn't met because of their specific plan. So I always encourage people with diabetes, patients that I interact with, to please know that difference, know where the coverage is, and speak to your doctor about that.
Thanks, Carrie. And maybe following up on that, is it possible to start CGM without going in to the doctor's office? So it sounds like there are a number of resources to learn for people to learn more about coverage, which we're happy to link to after the fact from DiabetesWise. But if someone is interested and they have the support from their HCP, how does that work? Are there remote training? Walk us through that, if you would, please.
Yeah, sure. So once a person with diabetes has their CGM device, specifically Dexcom, we'll speak about Dexcom G6, you can either go to your clinic if they have the facilities to train within your clinic, and if not, Dexcom has an entire group of certified diabetes educators that are available Monday through Friday from 6 a.m. to 5 p.m. Pacific time to walk through the remote training of the Dexcom G6. One of the things we did, which was unique as a company back in 2012, is knowing that not everyone wants to engage in multiple visits for their medical device training and so on. Some of them may not have access to the wonderful people like Stanford and Corey and his colleagues. So what happens when you're in the middle of North Dakota? So we really moved forward through something called human factors testing and studies that allowed the validation of self-training. So we actually have training online that's validated for anyone who can use that or view that video can successfully train on our product, the G6. And if that doesn't work, then you have the support of the patient care team that you can call, like I said, Monday through Friday from 6 a.m. to 5. So you've got the option of in your clinic with the Dexcom patient care team or self-training that has really been a part of Dexcom's training options since 2012.
I think I've used them, Carrie. I remember, I think, getting a box that had a CD-ROM in it, and it was, start your Dexcom. And I was like, this is great.
remember when there actually were CDs? Yeah, it was that long ago.
Yes.
We actually put it in and in your DVD and it played. Yeah.
I think that's really important information to be aware of, that's an option, particularly now in the COVID-19 era. I'd like to take a pause and go one more poll question. Keep asking our way to our audience, and then we'll come right back to you, Carrie. So could you line up the next one for us, please, Monica? Thank you. Again, we hear a lot about, understandably so, hesitations with new types of diabetes treatments, device or otherwise. And so just trying to understand better which are the ones that are most on the minds of our audience. Okay, I think we can go a few more seconds here. So it looks like the leading one that's coming back, from what I can tell, is cost, insurance, and coverage still very much on the minds of people. Wearability and comfort, understandably so, before you start wearing something to understand what that means, the practicalities of it from day to day. Avoiding lows, and another group that doesn't have any concerns. So that's kind of where our audience is at. Could be helpful to our panelists. But Carrie, I think that along those lines, and maybe we'll get to the cost and insurance coverage, you've spoken a little bit about it, but along the lines of, wearability and comfort, we often hear the question, is there a way to try it out? Is there a way to test drive it or trial the device? Is that something you've considered, or do you have any such programs at Dexcom?
Yeah. Well, back in 2006, when CGM was something barely, we didn't even understand what it was. We did have like a try it before you buy it program. But I'd say at this point, since really CGM is kind of assessed as the standard of care for glycemic assessment and control, we don't necessarily have that structure at this point. But I will suggest that for those who are really maybe cautious about making that jump and really acquiring a CGM system through their insurance first, there's two things to be aware of. Number one, a lot of our healthcare professionals, your physicians, diabetes clinics have the professional version of Dexcom G6. And so one of the things why I specifically say that is because the Dexcom G6 professional system is almost exactly like the personal system. So you'll be able to have that firsthand experience of how it's inserted. What does it feel like? Does my body react well to the system? Where do I put it, and how do I interact with the information? So I think through the professional use of G6 with various diabetes clinics across the country, and I always then, as a backup, there is a return policy for Dexcom G6 as well as all other CGMs. That really there's a 30-day return policy, right? So if you wind up taking the device, it's not for you, you can return it and go from there. And Kyle, if there's one more thing I could actually add, I do want to give the audience, because I saw the polling question where insurance coverage is still an issue. One of the general, I'd say, trends for Dexcom as well as the category of CGM is there's two different ways that insurance payers cover CGM, either through something called the durable medical equipment pathway or the pharmacy pathway. And what we're really trying to do for the benefit of the patient, access is quicker and it's somewhat cheaper out of pocket, is to really be able to set CGM up as being able to be accessed through the pharmacy policy. And what that means is that I can go to any CVS, Walgreens, you name it, I can get a CGM within about 24 hours, and I pay a copay of whatever my drug is. And what we're seeing now, at least at Dexcom, about 65% of those commercial patients that have commercial insurance can get Dexcom through a pharmacy benefit. It could be maybe $50 per component. So $50 for a sensor, $50 for a transmitter, and so on. The DME channel is a little bit more tough, more documentation, and it could then depend on your deductible, which oftentimes in California, the state I live in, could be thousands of dollars before there's any coverage. So I do want to give that glimmer of hope that the more you can adjudicate through a pharmacy benefit, the quicker the access, the cheaper to you for a copay.
Yeah, understood. Well, and I see a comment coming in on the chat that's actually related to, I think, the next series of questions, and one of the reasons we decided to do this whole town hall series, and that's about some of the environmental changes we're all facing and during this COVID-19 era. So I'm interested in knowing, what do you see kind of in the biggest change as how Dexcom as a company operates, and what's been the most difficult to adjust to?
Yeah, so I think we're all adjusting. So I'll talk as a company first, and then maybe a little bit more individually. So when COVID-19 hit, of course, Dexcom, like every other company, looked at the safety for our employees and the safety for our patients. The really good news is that Dexcom and CGM manufacturers are considered essential in the state of California and Arizona, where our manufacturing centers are. So there's been absolutely no deviation from 100% availability to our patients who are ordering Dexcom G6 at the time that they want it. So there's been no back order and so on. And we're really proud of that as a company, because I think everyone who knows CGM, they can't imagine living without it, right? So, and the last thing we want to do as a company is be the reason why our patients can't get the technology. So there has not been an issue. So our operations and manufacturing team are still going into our San Diego and Arizona-based manufacturing offices. Of course, we had to reshift as a company to make sure that they're safe under the new COVID-19 safety guidelines and so on. But no issues with access to our patients, which is good. But then we also had to shift to how we interact with our patients, how we interact with our healthcare professionals who are prescribing the product, and do more of these Zooms and do more of FaceTimes and so on, which, I'll speak on a personal side. I'm a, redheaded Italian, and so I really like people and the interaction of people, and, being able to just engage with them in a human person to person has just really been, I think, a challenge for me and a lot of my colleagues. But we turned that pretty quickly around, and we now have a platform as a company for patient-based webinars, HCP-based education and webinar, patient training, and also all the big conferences that our HCPs go to learn more about diabetes had to be completely rethought on a virtual platform. So it's been a lot of creativity, but we've gotten through, and we're looking forward to seeing people live soon.
And on that note, I'm curious, Naya, have you ever had issues with, as a person living with diabetes, where whether it was, during this era or before, have had a difficulty obtaining supplies?
I have not had problems with COVID, knock on wood, and being able to get supplies. There was a period of time in 2000, somewhere in the 2010s phase, where I did not have insurance. So I went from a pump and a sensor to a 70/30 pre-filled pen, which was an entirely different experience. I'd never used one before. So there was that. But having to adjust to that and deal with that. But thankfully, it's not as much of an issue now, and it's certainly not in COVID. I haven't had issues with being able to get supplies.
Yeah, and I mean, that sounds scary to me, because that's something that you're doing in and out, day in, day out, and then all of a sudden there's a kind of that forced shift overnight. And I think that's why it's so reassuring to hear from Carrie and Dexcom and other companies in the category that in terms of supplies, they're available, and it's not necessarily business as normal as per Carrie's comments, but in terms of getting supplies to people who need it, it is. And I find that particularly reassuring. Thank you for sharing your personal experience on that, Naya, as well. I guess the comment that I was referring to earlier in the chat was also referring to loss of insurance. and you just described that situation, even though it was prior to the pandemic. We're seeing a lot more of that, unfortunately, now. Carrie, I'm curious, in terms of the programs, I know that Dexcom has developed programs in the past for people that are eligible who may have lost a job or who have lost insurance. Would you be willing to share a little bit more information about those?
Yeah, happy to. It's I think all of us as humans are just trying to navigate through this crazy COVID and economic challenge we're in front of. So I'm happy to be able to say I work for a company that absolutely met that challenge because of the empathy with people that have diabetes. Again, we don't want to be the ones that are the reason why you don't have the device. So about I think maybe less than a month into the COVID-19 pandemic being the real thing, Dexcom stood up a patient assistance program for people that have lost their insurance due to the COVID-19 pandemic. And so you can go on the Dexcom.com website and go to, so it's Dexcom.com/COVID-19 assistance. And there's the details of this patient assistance program. But big picture is if you qualify, meaning you basically lost your job and your health insurance due to the COVID-19 pandemic, we can ship up to 2 shipments of 90-day supplies for the Dexcom G6 at $45 each. So that means 90 days of sensors, the transmitter for $45, and 2 shipments to cover about 6 months worth during the COVID-19 pandemic.
And we'll link. I think we posted it on the chat, but we'll link to information that you've provided us so that people can either call in and find out if they're eligible or learn more about these programs. I think that's really wonderful to hear. And I think as Corey commented on the chat as well, we've been in touch with the other manufacturers of CGM devices who, some of whom have similar programs, and we'll pull together all that information and make it available for people that are interested. So please have a look at our website, and we'll link that information shortly. Moving on in this discussion, I think this is a really good discussion so far. I'd like to go to the topic of telehealth. And perhaps going to you, Naya, first. I'm curious, which healthcare professional did you interact with primarily before the pandemic? And how about now? Has that changed at all for you personally?
Because diabetes is such a large part of my life, whether I like it or not, I interact mostly with the doctors that service that. So my endo and then the nurse practitioner in his office are the two primary healthcare providers that I meet with. And I have had an appointment via telehealth with that nurse practitioner. It was great. It is an option in COVID setting. Diabetics in general check the boxes for people who should stay indoors and wear masks, along with the rest of the population. So it's nice to be able to know that I do have access to my healthcare providers, even if I can't be in the same room with them, to be able to discuss concerns that I'm having as it relates to my diabetes.
And maybe going right over to Carrie on the topic of telehealth. How can your device help people living with diabetes communicate with their care team? Is Naya's example a pretty typical example? Does it vary by clinic? How about carers for people with diabetes as well?
Yeah, I really love this specific conversation because, I think whether we like it or not, people are getting busier in the world, and sometimes that face-to-face, even outside of COVID, doesn't always happen or isn't accessible. So there's 2 specific things I'd like to speak to about Dexcom G6 and how to help in this kind of remote monitoring world as it relates to your diabetes management. One coming from a patient perspective and one coming from an HCP perspective. So for those of you that aren't familiar with Dexcom G6, there's a feature called Share Follow. And what that does, it allows the person with diabetes to invite up to 10 people that are loved ones, friends, family, in some cases, healthcare professionals, to actually look at and be able to view their real-time glucose information. So Naya could say invite her best friend, her mom, other colleagues, you name it, other children with diabetes folks, to follow her, and then that follower can actually be alerted when Naya's glucose is high or low. And one of the things that's nice, and I think Corey will appreciate this, is this is a person with diabetes decision. First off, who follows me, if I even want people to follow me? Do they see all my information, or do they just see my glucose number and arrow right now? Are they alerted to alerts and alarms? So it's really a conversation between the person with diabetes as well as those followers. And maybe I can show you guys this. This is my cell phone with the person that I follow and her glucose right now. I'm have my fingers covering her name, but I can see that this loved one of mine is 156 with a flat arrow, so no issues with highs and lows. And that's 24 hours, 7 days a week, all over the world. When my dad was living and he had type 2 diabetes on Dexcom, it was intensely managed. I was traveling all over the world for work and was always at kind of peace of mind that dad was okay. And I think that's a great thing for quality of life for the person with diabetes, and definitely for the person that loves that person too. So that's one aspect. And I'll give you some just general data from Dexcom. When we looked at our patient database, it's all de-identified, so we don't know who. And we asked the question, in the pediatric space, how many of our pediatric patients are using the Share Follow feature? 95% of our people under the age of 18 are using Share Follow at some level. And in the adult side, which I understand, closer to about 55, 57% are using that feature. So it is a feature that really is well utilized. And we're actually seeing that, at least in the pediatric population, the more people are following that person with diabetes, there's correlational evidence that their time in range, A1C, and so on actually improves, right? So that's always something really nice to see and see that trend. And the second thing I would add besides that would be, you've got the function of Dexcom Clarity. Other things where healthcare professionals come from, they may have their own favorite software, whether you use Gluco, Tidepool, Clarity. Dexcom communicates with all of those softwares, so any preference of your doctor can get the data from Dexcom G6 by having the patient just use their cell phone. That data is automatically sent over to your clinic, your HCP, if you set that up, and they can pull up your information at any given point. So Naya can call her endocrinologist and say, look, I'm really or diabetes educator, really having challenges with with hypoglycemia recently. I hope that's never your case, Naya. May that never be your issue. But if it does come up and something's new, her endocrinologist can click on Clarity or the software, get what's going on in the last 14, 30 days, and really help her work through some of those problem-solving techniques without having her be right in front of them in the clinic. So that's I think the two big things is remote monitoring through Share Follow and the use of Clarity, or that kind of CGM software that shows you patterns for each patient.
And if I can comment on the Share Follow, I have my sister and one of my best friends who has diabetes on my follow. My mother's not allowed to follow me because she asks the question as to, why is your diabetes doing this? And I'm like, because it's a phase of the moon, Mom. I don't have a good answer for you. But my same best friend who follows me, I now follow her. She just got started with Dexcom G6 and Control IQ with Tandem. So we're Share Follow buddies, and the other day we actually had the same blood sugar. So it's a game changer.
I'd just like to hone in on the comment you made there, Carrie, in terms of troubleshooting or problem solving, I think is what you use, which is a better term. I'm interested in taking a step back to basics. We have a number of people in the audience who are still discovering and learning about CGM. Naya, if you care to comment, I know you've worn it for a long time now in different generations of different devices, but what was it like for you the first time you're seeing your numbers live, so to speak, and your trend arrows live? How did you react to that, and how did that impact kind of your thoughts about diabetes management?
It's the best thing since sliced bread, at least for me personally, because as I said, I am a keys, wallet, phone, out the door kind of person. Diabetes required me to plan ahead a bit more. And do you have a snack? Do you have a site? Do you have this? Do you have that? With Dexcom, within the first 10 minutes of wearing the G4, because that was the first iteration that I was able to get, if I know what my blood sugar is, that means keys, wallet, phone. I make sure there's snacks in the car, and I keep moving. It was total game changer. And now that it's integrated on my pump, because for a while it was a separate receiver, and the minute that Tandem and Dexcom got integrated was the second happiest day, because then I didn't have anything else that I could lose. My pump is already attached to me, so I can't lose that. Didn't have to worry about losing the receiver, the receiver portion of the Dexcom as well. It was truly life-changing for me.
And you mentioned something there about partnerships between different tech companies, in this case, Dexcom and Tandem. How did that factor into your decision about which devices you were wearing or how they would work together and so forth? Because we hear in the patient community, I think, a lot about announcements of different companies working together. Did it impact your decision?
It did not. I fell in love with both companies for different reasons. And when I found out that they were going to partner, I said, oh, this is kind of awesome too. I think that companies should work together more, because the more brains you have collaborating on a problem, the faster you get it solved, and sometimes the more creative the solution is. But it just so happened that the two companies that I use and love were partnering, and so it was sort of a natural thing. I was like, this is great. Everything's going to be integrated. I can't lose things if they're attached to me. So I would like to see more partnerships, because it only makes life better.
Fair enough. Carrie, anything to contribute on that topic as far as partnerships? I know you, as a company, are working with a number of different partners out there, probably many of which you can't even speak about publicly, but anything to contribute on the idea of partnerships to get us all excited?
Yeah, I'll share Dexcom's general philosophy is that, we are able as a company to deliver and show a very personal side of a person with diabetes. They're every 5-minute readings. And we definitely have the philosophy of that's your diabetes, and the data that's generated from your diabetes really should be open to any platform that's willing to ingest that information. And I really like that philosophy of our company, and you can see that by our partnerships. So one of the things that Dexcom, we were the first to get a FDA designation known as interoperable CGM. So interoperable CGM really has a very high bar of accuracy, and once you meet that accuracy, you're kind of in this elite group of interoperable CGM. And with that, then a secondary part of it, not only are you really accurate, you're able to more seamlessly interact and integrate with other diabetes devices, whether it be Bluetooth connected pens. So we are currently right now able to have a communication with InPen, which is a Bluetooth connected pen, the only one available right now, for insulin as well as glucose information, both on the device as well as downloading in Dexcom Clarity or their software or Gluco, and you name it. So we're moving forward even beyond that, where we're working with Eli Lilly and Novo Nordisk when they come in with their Bluetooth connected pens. So no matter how you decide to deliver insulin, if you love pumps, great, but if you want to stay with injections, you have that opportunity to get that integrated information. And then on the pump side, several partners we've got at this point that's commercially available in the US. We are really happy with the Tandem Control-IQ, really the first advanced hybrid closed loop that's out there. So really happy to see the basal bolus opportunities you see there, as well as some of the corrections you can have when you're high, and really maybe helping with taking some of that burden of diabetes management all the time off that patient. And then also looking at Insulet and the Omnipod 5, their patch pump integrating with Dexcom G6. And then we have a couple other that are commercially available but in Europe, but worth mentioning in case the audience is interested. Dr. Roman Havorka at University of Cambridge just recently got an approval for his long-term coming hybrid closed loop system, so insulin pump and the Dexcom G6 integration, and his own algorithm. So basically these closed loops or automated insulin delivery is an algorithm, a pump, and a sensor. And so what makes these devices different really tends to be the pump used and the algorithm used. So it's the CAM APS FX system that's available only in the UK right now by Dr. Roman Havorka. And then there's also a new system in France known as DiabetesWise, and they are also a hybrid closed loop that is available really only in France right now. It was definitely vision to go globally. And so, we're really happy to have all that. And then the other kinds of partners we have is just maybe the person that doesn't want to necessarily connect insulin and CGM. They just have really good diabetes patient apps. I love the Under My Fork is an app that has been phenomenal, where you can take pictures of your food. You go to your favorite Thai place, and all of a sudden your glucose is through the roof, and you're trying to chase the highs, but you're not willing to give up your favorite Thai food. Take a picture called Under My Fork, document what you bolus, how you bolus, and then learn from it. And so ingest the CGM information into this app so you can help balance your food and the coverage with insulin appropriately. So really we believe in the pens, the pumps, and just data integration overall with diabetes apps.
Good to hear, and we'll actually be having some of those companies represented in our session next week on insulin delivery systems. So we hope to deep dive into some of those systems and in the U.S. market next week. Well, I know we're getting close to the top of the hour, and I've seen a few questions come in. So I thought it might be a nice time to open it up to questions. I think we had at least one that was mentioned on the chat. Sierra, would you be willing to identify that, please?
Sure. So this question comes in from an audience member who asks, is CGM more directed towards type 1 than type 2?
I can jump in and then, love everyone else's input. But I think I speak from a clinician perspective first. I think anyone who has diabetes will benefit from a real-time CGM, because whether you have type 1, which is, I would say in general, your type 1, type 2 patient, when they're on intensive insulin therapy, there's physiologic differences in the disease, but they're taking intensive insulin management, and the risk is insulin driving that glucose low and that risk. So if you look at type 2, whether I'm type 1 taking multiple daily injections or an insulin pump, and a type 2 doing the same, I clinically don't really treat that patient any different because they're taking the medication of insulin that keeps them at risk. If you go, so I would say at this point, the other challenge is the payer group. The payers, hands down, will cover for people with type 1 diabetes CGM. About a third, growing a little bit farther over time, of those with intensively managed type 2 will cover CGM for the commercial side. Medicare, type 1, type 2 intensive managed, you're good to go. And I think the other thing we see going forward, not only Dexcom, but Abbott and other companies, is the majority of people with diabetes have type 2. And when you're able to actually see what diet, exercise, and lifestyle can do to your glucose, like my dad, I will tell you, he thought cornflakes and a banana was the most healthy he could ever do until he put a CGM on and his glucose was 358, 1 hour and a half after, and he's like, well, we need to change that. He wouldn't know that without using CGM. And I think you can get those lifestyle benefits, maybe more intermittently, from someone who isn't on intensive insulin managed therapy.
Thanks, Carrie. Naya, anything to add on that one?
No, I think Carrie said it pretty succinctly. You do see a lot more use in the type 1 community, but I do know, I have friends with type 2 who wear CGMs as well for the exact reason that Carrie talked about, being able to see data and know, okay, I am currently 119 with a downward arrow. I should probably try to find some gummy bears. That, that's a data point that dictates what do you do next. So.
Very good. Sierra, do we have any other questions lined up? If not, I've got a couple more on my list that I'll be happy to jump in with.
Yeah, I think you should take it away, Kyle.
All right. Well, you mentioned regulatory announcement or categories, Carrie, and I know that you can't speak on behalf of your your regulatory department. But I think it's important nonetheless for us to acknowledge how much work device manufacturers have to go through in order to validate and verify these medical devices, since we're making life decisions, management of our diabetes based on them. So I was just wanted to open it up to the discussion. So you mentioned iCGM. Are there any other announcements, whether it's regarding pediatric versus adult, that we should be aware of for this category?
I think, without tipping our hat too much outside of what's been publicly announced, is, we're really looking at, trying to have CGM be the standard of care across all age ranges. So right now, currently, we're indicated down to age 2. There's conversation, do we need to go low, younger in age than that? There's also continuous decisions and conversations about our next generation product, G7, which can be smaller, more cost effective, longer sensor wear. So there's all those things that we really get a lot of feedback from our people with diabetes wearing our device that we constantly want to iterate. And I think one of the things I want to share with the group is it's not only about the device and smaller and easier and so on. Also, access has to get better and cost has to get better, right? So it's across the whole spectrum. And that's not necessarily a regulatory, but it's across the board. And I think partnerships at Dexcom is very important. I think you're going to see that across the platform. FDA, Courtney Elias a long time ago had a vision of basically you've got CGM, you've got insulin delivery, and you've got algorithms that drive that insulin delivery based on the CGM. Those should be interoperable with any patient's choice. And that's my vision, is that every person with diabetes is able to say, I want a Medtronic pump, I want a Dexcom sensor, and I want this control algorithm. The doctor says, okay, it's prescribed and it's yours, right? That would be an amazing vision, which, I think with our the iCGM or interoperable CGM, that's really what we're trying to drive toward.
Well, this has been a wonderful discussion. We're close to out of time, but I just want to give you one last opportunity, Naya or Carrie. Any last comments you'd like to make to the audience?
It's all yours, Naya.
For those who have diabetes and you know exactly what it's like to live with this disease, the things that we can find to make it better or fun are sort of our own. We are the community. And we are nothing if not adaptable. So, we share, we promote each other, we answer each other's questions. If you have questions, if you're new to diabetes and you're like, I have no idea what I'm doing, the internet can be your friend. There's a lot of great resources. I'm sure that Kyle will post some links to some of those resources that, you can make friends and find out about the technology and devices that are available. And, it's weird out now with COVID, but it will get better. And that's it.
I think that's a good note, a positive note to end on. I'd like to give a huge thanks to our panelists, Carrie and Naya, as well as thanking the other manufacturers in the category, Abbott and Senseonics, for having provided information. And in addition to the Dexcom information, we'll make that all available via the DiabetesWise website. And while you're on the website, please take the opportunity to look at some of the wisdom videos, look at the testimonials of people living and breathing with devices, the impact on their daily lives. We hope it's interesting to you, and give us feedback on what you'd like to see more of. Thanks so much to Dexcom and Carrie and Naya again, and we look forward to seeing you hopefully next week around this time. Bye-bye, everyone.